Professor, good evening, and thank you so much for your time. I know that you've done extensive studies on treating coronavirus, so I'm sure you have a lot to say about how the politicians give out their messages. What did you make of what the US president said? We shouldn't be afraid, life goes on, and also, yet again, comparing coronavirus, COVID-19, to flu. Is that a good message to send out?
Sally, good evening. I've learned very early on in this pandemic that when we look at the coronavirus facts and the non-facts, so the fiction part of it, we need to separate it very clearly from what the politicians are saying. Because as soon as you link it to a Johnson or a Trump or even a Putin, immediately people do not listen to you and facts can be blurred. So we must be very careful to listen and take everything that politicians are saying. Johnson was correct. Obesity is a predisposing condition, so it is one of the comorbidities, and it does place you at larger risk of developing severe COVID. Others are diabetes, heart disease, so we know this. And it appears from the science that all of these comorbidities are somehow linked to inflammation. And we know that severe disease, severe COVID, is really either hyperinflammation or blood clotting problems. So you have organ damage, particularly the lungs and the heart and the kidneys, and in some instances the brain. And in those cases, you develop COVID. As for is it similar to flu, we must be very careful when we make those type of statements, because yes, up to now, the figures for this and flu looks very, very similar. They spread more or less the same way, and the molecular biology, the way they behave in the body seems very, very similar, but they are different viruses. So we must be very, very careful about the statements that we listen to and those statements that we take as fact or not.
Yeah. I'm interested in your sort of medical assessment, because you've done so much work on coronavirus treatments. We know that with Donald Trump, his doctors did something which people are saying is unusual, and you'd know. They put him on remdesivir, they put him on dexamethasone, and apparently this antibody cocktail, which the doctors are saying no one else has got. Tell us the truth here. Is this a combination of drug treatment that is highly unusual?
Sadly, so yes, for such a combination, it is unusual. So I'm a scientific reviewer for many medical and scientific journals. And all of the medication that Donald Trump has been given is effective. Obviously, it is not 100% effective, but it does improve the chances of surviving COVID. The only problem is that they are typically given in severe cases of COVID. So they're typically not used for mild cases. And if we look worldwide, the number of severe cases are extremely small. I looked at the numbers today, and mortality rate, case mortality rate, so based on the number of positive confirmed COVID cases worldwide, is less than 3%. That's a very, very small number. Compare that to 2009. We remember the swine flu we had in 2009? Some estimates say that between 11 and 21%, that's between 700 million and 1.4 billion people, were eventually infected with swine flu in 2009 over a 19-month period. And this was with all the flu drugs that we had, all the vaccines that we had. So coming back to your question, yes, it is very unusual, this cocktail, for somebody that's not severe, but all of the drugs that has been given has been shown to be effective in many, many studies.
What do you, if you have to assess, as you say, it's not ideal for politicians to speak out on health messages. We do know, though, that South African politicians were lauded, particularly in the beginning of the pandemic, for really raising the alarms and saying we've got to take this seriously, because at that stage we didn't know what this virus would do to people with HIV and TB. As it turns out, it seems not to have had a specifically adverse effect on them. But if you have to look at the politicians around the world and the messages that you hear coming in, who's got it most right, in your view?
You know, Sally, sadly, as politicians, I think that they missed the previous coronavirus outbreak. So we had a huge one in 2003. We had one in 2014, and these were other coronaviruses. So we could have expected that HIV individuals would not be at greater risk. So there was lots that we knew from those pandemics between inverted commas, because they were never the size of COVID, the COVID pandemic. But we knew that antiretrovirals, HIV antiretrovirals, in those cases were effective. There were some traditional Chinese medicines used with those that were effective. Anticoagulants, so preventing blood clotting, was effective. Steroids to prevent inflammation or to lower inflammation, those were effective. So I'm not quite sure why it took us about 7 months to test all of these and figure this out. It's almost as though we did not learn, and this was a worldwide occurrence. We did not learn from the past, and that was a bit sad, I think.
So do you think Trump is right to dismiss it?
I don't think we should dismiss it, no. I think that the wearing of a mask is still extremely important. Physical distancing, not social distancing, let's call it physical distancing, is extremely important. Sanitizing your hands is extremely important, because all of us know somebody who is at higher risk. And I wrote an article for the Cape Times in March where I said, let's focus on protecting those who are at higher risk, above 65 with comorbidities, and our medical personnel. In 2003, 2014, with SARS and with MERS, some of the biggest outbreaks associated with those were linked to medical personnel. So we knew this. So this is not something just to flip off. This is important, especially if it's somebody close to you that's affected.
Absolutely.
And I think that's important. And for that reason, we need to maintain all of the measures that were put in place.
Absolutely. Well, thank you very much. Very interesting insights there.